take trending health topics, put them under the lab microscope, and sort fact from fiction. I'm Melody.
I'm Stat Stephanie.
And I'm AA Odie.
And today's hot topic is the Orchid shot, also known as the O shot. It's a procedure that promises to revolutionize women's sexual health with just one injection. Yep, you've probably seen it on TikTok, or you could have caught it in a wellness ad.
That's right. The O shot, short for the orgasm shot, is marketed as an in-office treatment where clinicians inject platelet-rich plasma, or PRP, into a woman's vaginal area. The pitch is better orgasm, improved lubrication, treatment for urinary incontinence, and even relief from, help me out here, Melody, is it lichen?
Lichen cirrhosis.
I'm a medical professional, y'all. Yes.
You are.
Lichen, yes.
Yep. So right, if you Google it or scroll on Instagram, claims make it sound like it's this amazing silver bullet. But does the science back it up? This is where we get down to the science. So that's what we're here for. We're going to kind of unpack that today.
Yep. So, okay, lab fans, let's inject some facts into this conversation. See what I did there?
That's what you did there.
I see what you did there. Rich plasma is blood that's been spun down to concentrate the platelets, which contain growth factors to promote healing and tissue rejuvenation. So the O shot is an off-label application of this PRP, which is injected into the sensitive vaginal tissue.
And yes, so PRP has some legit uses in medicine. So like in sports injuries, healing wounds, even dermatology application. So there's some applications for everyone. But extending it to sexual function, that's kind of where the evidence starts to kind of thin out a little bit.
Right. I mean, even like you go to Johns Hopkins website and find out, for sports therapy and even like hair loss, like for men. It's really interesting. Yeah. So, for marrow pattern baldness, look at that. But now
we're trying to say, Melody.
I'm not trying to say anything, Aaron. I mean, you take that on for yourself if that's what you're thinking. Okay. Influencers and even some clinics do have some claims that it enhances sensitivity, boosts libido, treats stress, urinary incontinence, specifically in like the older adult population. You may have seen names like Dr. Charles Runnels, who actually trademarked the O shot name. And so he'll pop up in marketing. Yeah.
But here's the catch. So there are very few actual peer-reviewed clinical trials of the O shot. And I'm going to use my finger air quotes here. So these studies are small case series, often, my small air quotes. And these studies are often uncontrolled, and many are produced by clinicians who are actually selling the procedure. Yeah. So there's a conflict of interest there.
Yeah, exactly. I mean, for example, one 2014 pilot study suggested possible benefits for female sexual function, but you really only had like 20 participants. It wasn't randomized. They weren't really a placebo group. So that's not really a gold standard when we were doing scientific research.
Right. And I think you also need to stress that major medical societies, including like ACOG, which is the American College of Obstetricians and Gynecologists, have said like there's insufficient evidence to recommend this as a standardized treatment.
Yeah, so let's be clear to our listeners that PRP is considered experimental in this context of the O shot. So you do have patients out there who are paying, this is an expensive procedure, $1,500, $2,500, depending on where you live, a pop per injection for something that's not covered by your insurance and not backed by robust science or research.
Oh, no.
Now, can we talk a little bit about, patients are doing this for a reason, right? They're walking in there. They've got feelings, obviously, about it. Maybe they have some desperation.
Maybe they don't have feelings, and that's why.
Yeah. But emotional feelings.
Yeah.
That's just not something, we talk about much, right? Like openly or have a lot of resources for. And so if you were desperate for a solution for your home life, do we feel like they're preying on these people a little bit? I mean, I don't know. Like, and labs are labs support, like who's processing the specimens is what I want to know, because they're taking it from the patient. I mean, it's your own. It's autologous or whatever you want to call it, but
Yeah. Are these actual like CLIA labs?
right.
It's probably like a doctor's office that's set up like a tiny lab.
hmm Yeah, if you are working in, I'm gonna use my finger quotes again because they've been really popular this episode, in a
Mhm.
lab that is doing this procedure and preparing PRP for these injections, hey, reach out to us and tell us your perspective, because maybe you've got an outlook on this that we can't find in the literature and maybe we don't see from the research that we've done to build this episode. But let's get it straight. I mean, there's a lot of facet of commercial and cosmetic healthcare that does, like Dr. Nelson said, prey on individuals' insecurities or the thought that they should have something that they don't have in their life or in their body or in their experiences, and that they could get sold that at a quick, cheap price. And sometimes, if you're not backing that up with science, you can come with additional health risks.
Right. I mean, there's this whole idea that it's my own blood, so it must be safe. But, you know, injections anywhere can cause pain or bleeding, infection. You can get nerve injury. We also lack like long term data for this, like repeated injections into genital tissue. Like, you got to think about that. You're already in an area that has normal flora, right? And the opportunity for opportunistic infection. So if major societies are urging caution given limited efficacy data, like I think it should be a red flag. And I'm not even sure like what the FDA thinks about this, you know?
Yeah, and you kind of touched on the whole potentially opportunistic infections. Anytime you're introducing something that's not normally there, and in bypassing some of that normal vaginal area and the flora there as well. But separate related, you kind of touched on it, just like the FDA kind of has warned about aggressive marketing of a lot of these energy-based vaginal rejuvenation devices, so laser kind of treatments for the sexual function and incontinence. It's not approved for those indications. It has been shown to kind of be linked to burns and scars and pain, so you have to be kind of careful when you're doing one of these treatments. Besides the cost, there are risks. Different modalities than our PRP, but the overarching message is, don't oversell unproven therapies. If you know something's not, the data's not there, then don't try to oversell it.
Right. And I do think it's important, like for laboratories, like I didn't even know this was a thing, really. You know, I'm not on, I guess I live in my little lab, like four wall cubby hole, but like I didn't even realize that this was as widespread as it was until I went to a conference and someone was talking about it. And I was just like mind blown. I was like, are people actually doing this? Like, they're actually doing this? And so, it's important to remember, like, patients could come, or I even asked the lab, like, do you have platelet-rich plasma, or like, where can I get that? Or you're drawing my blood, like, can you draw an extra tube because I'm going to go somewhere else? Like, you could get those kind of inquiries. So I think it's good that we're talking about it. And if a patient were to ask about it, I think we really need to keep conversations open. We never want to be like judgmental. I know we have fun on the podcast. It's kind of like talking about it, but evidence-based is the way to lean in. You know, we have to emphasize that these are experimental. Studies are small. They are biased studies, the ones that are out there, most of them. Long-term safety isn't clear. And if they're dealing with these issues, like there are proven options and appropriate testing, a small sentence or two that really kind of helps staff and like maybe specifically probably blood banks or even like phlebotomy areas, that if they do get asked for extra draws for, so that they can take the blood with them, like that they understand the policy for that, because typically we don't allow patients to walk off with blood
Mhm.
things. So, yeah. I don't know, like, what do you think about like validation of their concerns? And like, there's like a line there, right? And then scientific relevancy.
Yeah, I mean, validation is key, like you mentioned. When we do acknowledge their frustrations, and we do feel the that, it is hard having to try to find that balance and to actually find things that will help with your sexual health, but make sure that they're actually thoroughly researched. So you just have to be careful to make sure that these aren't just experimental.
Yeah. And if you are talking to a patient and they express that they've, experienced some unusual symptoms from trying this, like pain or bleeding or infection or any of the things we've mentioned, we would advise them to go seek prompt medical evaluation. All right. So I think, oh, go ahead, Melly.
No, I was just gonna say, like, it might not be a patient, like it could be a friend, or
Yeah.
like a family member. I think that's important for us to like highlight is that
Mhm.
we talk about this a lot, like it's somebody maybe you don't know, but you read about people who get like BBLs and stuff and they get them done at facilities and they end up passing away because of the procedure. They get an
Yeah.
infection or something. Like if you're a family member of these individuals, like it is, and you're scientifically educated, I think it is a responsibility we have to just say, hey, like, have you read these things? Like, are you sure about this? And like, try to have some of those critical conversations. Anyway, that's
Yeah.
all I was going to say.
Yeah.
I will say a procedure is a procedure and everything comes with risks. So we want to just make sure that we're weighing what we think are the potential advantages from doing anything medical, to what are the proven and scientific risks. So, I mean, I think we have debunked this to death. Bottom line
Yeah.
is that OSHOT is trending, but it's not yet supported by strong science. Like any quick fix in healthcare trends, the promise is ahead of the proof. And so please be careful if this is something you are considering.
Yeah, and if it sounds too good to be true with any of these online or experimental kind of things, it probably needs more data, especially when it comes to with a hefty price tag where you're actually having to pay quite a bit. So we'll keep watching the trials and the guidelines.
Yeah, and for today's references, we pulled ACOG guidelines, PubMed reviews on PRP and gynecology, and also some clinical commentaries on regenerative medicine and women's health. And so if you're interested in those, like, let us know. We can get them posted in episode notes.
Yeah. So until next time, subscribe. Let us know your thoughts. If you've got any questions or your own personal experiences, hey, let us know. Like I said, we're open. Until then, stay curious, stay critical, and especially stay super in SUPERSTAT.